Hello everyone, my name is Sanchari. I'm a clinical psychologist working in Tulasi Healthcare, Gurgaon. Today I will talk about anxiety disorders. Anxiety is a mental health condition characterized by feelings of worry, fear, and tension. Often we use anxiety and fear interchangeably, but there is a difference between the two. Fear is actually an emotional response to a perceived or a real threat, whereas anxiety is an apprehension of a future threat, which may not be real always. Also, anxiety is strong enough to interfere with one's daily activities. It is severe and persistent. It can go beyond 1 month, 2 months, even years, and the individual often has no idea what he or she is suffering from. So, if the identification becomes easy with anxiety disorders, it's very important to recognize one's signs and symptoms of anxiety disorder. There are some common signs and symptoms like feeling restless, being nervous, feeling tense, having an impending sense of doom or danger, shortness of breath, trembling or shaking, difficulty to control the thoughts, having an urge, a very persistent urge to avoid the situations that trigger anxiety. Now, it's not necessary that every individual goes through the same symptoms or every individual will have all the symptoms. So, in order to classify, there are three types of symptoms. One is physiological or physical symptoms of anxiety. Second is cognitive symptoms of anxiety. And third is behavioral symptoms of anxiety. So, physiological symptoms of anxiety are usually external and visible, like trembling or shaking, palpitations, sweating, muscle tensions, having a dry mouth, etc. Cognitive symptoms are usually which interfere with the thought processes, like frightening thoughts, confusion, being disoriented, difficulty in concentration, narrowing of attention, poor decision making, difficulty in memory. Third is behavioral symptoms of anxiety, which can range from having restlessness, pacing back and forth, difficulty in speaking, also a lot of agitation or anger issues. So these are the three classification of signs and symptoms of anxiety. Now, it's very important to understand the types of anxiety disorder and what each of these types have the signs and symptoms. So the first is generalized anxiety disorder. Generalized anxiety disorder is the most common because it is characterized by marked fear in almost every situation. For example, work or school performance. Usually the symptoms are muscle tension, headache, fatigue, irritability, sleep disturbance, always being on the edge or always being keyed up about things, and the mind goes blank during generalized anxiety disorder. The second category of anxiety disorders are phobic anxiety disorders. Phobia is an irrational fear relating to a specific object or a situation. The first is specific phobia or isolated phobia. Specific phobia is usually marked fear receiving an injection or towards particular animals like reptiles or darkness, thunder, heights, etc. Second is social anxiety disorder or what we call as social phobia. It usually happens in social situations. For example, meeting unfamiliar people, having conversations, or even when we are being observed, like while eating or drinking, or giving a speech in front of others, so any kind of performance. An individual with social phobia almost always feels that they are negatively evaluated by others and they feel that they will be humiliated or embarrassed. The third category is agoraphobia. It usually represents a cluster of phobias wherein an individual is very fearful to get out of home. So it may be fear of open places such as parking plots, enclosed spaces such as elevators, malls, or theaters, or also being in a crowd. An individual with agoraphobia feels that escape might be difficult or help might not be available if he or she has anxiety-like symptoms. The fourth and most important is panic disorder. Panic is an intense, abrupt surge of fear which reaches a peak within minutes, and it usually accompanies with physiological symptoms like trembling or shaking, chills or heat sensations, fear of losing control, smothering, nausea, choking, also fear of dying. The duration is at least 5 to 10 minutes, but it can be long enough. Also, an individual with panic attack feels that they can have recurrent panic attacks in the future. So if any of you have all these signs or symptoms, or if any of you who know your dear and near ones are suffering from these type of signs or these type of disorders, then please don't hesitate to consult a mental health professional, be it a psychologist or a psychiatrist, and get relevant treatment with the help of medications and psychotherapy sessions. Live a healthy, happy, and safe life. I hope you have understood the information and understood the signs and symptoms of anxiety disorders. Please, if you have any queries, contact Tulasi Healthcare. Also, share this channel to spread more awareness about anxiety disorders, and please subscribe. Thank you so much.